right, welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Michael Morkos. He's an endocrinologist and he's the author of the book, No Work After Hours, Tools to Maintain a Pleasant, Efficient, and Productive Clinic Without Work Before or After Hours. There's an excerpt from that book on Kevin MD. Michael, welcome to the show.
Yeah, thank you so much, Kevin, for having me today.
All right. So just briefly share your story and journey and talk about what led you to write this book in the first place.
Yeah, I think about those coming to medicine as one of two paths, medicine or surgery. And in medicine, we take pride of having a long-term relationship with our patients, and we take pride as well in having long encounters and taking care of whatever a patient needs in between visits as well. And I found that I was struggling with a lot of work before and after hours, with never ending in basket and phone calls and long encounters and having to finish charting and notes after hours. And definitely, I was not very eager to leave medicine and look for alternative careers. So the question was, how can we make it an efficient process while maintaining excellent outcomes?
Wonderful. And like you, I'm in a cognitive specialty, internal medicine. I do primary care, and the story that you say resonates with a lot of us. You have what's called pajama time, where you have to finish your charts late into the evening. So interested in hearing some of your tips. So on your expert, you talk about tips for physicians in mastering the art of efficient patient encounters. So just share that article, talk about it for those who didn't get a chance to read it.
Yeah. So in few tips that I shared in the article, the dream that I had was how can I start on time and finish on time?
Yeah.
So not pre-charting, no work after I leave the clinic. So I pre-chart before I see the patient. And then how can I finish the note, all of the orders, labs, imaging studies, and prescriptions during the encounter? And by the time the patient leaves, I'm done with all of that, including my note and the charge. So the patient is done, I'm done. The last patient is done by 4 p.m. I'm done with 4 p.m. I leave. I don't have any work after that. So the proposal I had in the documentation, you got different ways to do it. Some like dictation. So they're going to finish the encounter and go after that and dictate their note, which means the encounter now is longer. Some are more efficient that they write in the patient encounter, but the problem gets to be that they face the computer screen. Mm-hmm. So they are not maintaining eye contact. So the patients are not happy, they are not satisfied, and they don't feel heard. If we are not maintaining eye contact, I will not feel that you're hearing me or respecting my presence. And some will rely on AI, which gets to be very interesting and very helpful. What I found problem with DAX or whatever AI model that is being used, that they get paragraphs. Mm-hmm. They don't have bullet points, or at least so far. And I guess being obsessive with my note, and I like it in a certain way, I doesn't suffice, or at least so far where I am. Mm-hmm. So the proposal I had is to have the physician having a cart with a laptop. Mm-hmm. And then a patient come in, I'm going to bring that cart down, I'm going to face the patient, and the computer going to be at a lower level. And while the patient is talking, I'm touch typing. So I'm maintaining eye contact, I'm finishing everything. And then by the end in the assessment plan, I write out loud what I'm writing as the assessment plan and the instructions. So the patient, when they leave, they have written instructions on with everything I said, and my note is done as well.
So how long have you been using the system for?
6 years now.
Yeah. And how fast do you type? Because I can imagine if you touch type your entire note, including the history of present illness and the assessment and plan, sometimes even when you're facing and talking to the patient, you have to type pretty quickly in order to get that done in real time.
Right. And also write less. So I don't write long paragraphs, right? So when I learned touch typing, that was while preparing for the clinical skills exam for the USMLE. So I didn't have it like growing up. Back then, I was touch typing 15, 20 words per minute. Right now, I go anywhere from 50 to 80 words per minute.
And then after the patient leaves, your entire note is complete? Do you have to do any editing, proofreading afterwards?
No, no, I'm done. So truly the patient leaves and I'm done. And it's a growing and learning curve, which is interesting that I track. You get these reports from the HR on how long the patient visits are.
Hmm.
And I guess the one who benefited the most from the books I wrote is me, because I can see that my speed in the visit while maintaining, again, great clinical outcomes and great patient satisfaction, of course, as well. The patient visits are shrinking. My documentation is faster. My orders. I mean, the two other things that I talked about is orders and EHR workflow. I guess I have a computer engineer in my heart. That's
Hmm.
why I like EHR so much. Having order panels instead of searching for each single order every single time with every patient made my life far faster. Adjusting my workflow and seeing what is my workflow and adjusting the tabs to be the fastest meeting what I do made a huge difference in speeding up my abilities and allowed me to see more patients while still finishing on time. And in my practice, we had 20-minute slots for
Hmm.
established and 40 minutes for news. I found that I'm finishing seeing the patient in 5 to 10 minutes, and I'm just sitting doing nothing. So I was able to add more patients while not overloading myself.
And I think the key is having the ergonomics of your office visits. So you mentioned a cart where I assume you have a laptop on the cart and
Right,
you have the screen that is positioned in a way where you can do the touch typing, but also maintain eye contact with the
right,
patient. You're facing the patient as you're typing out your note.
right.
So talk to me about AI scribes because that's all the rage now, right? It's
Right.
advertised as a solution where clinicians can reduce their cognitive load and maintain eye contact to the patient. And full disclosure here that this podcast is, of course, sponsored by one of these systems, a Microsoft Dragon Copilot. So you mentioned that you had an experience with AI Scribe, but the notes that they generated weren't to your customization.
Right. So I believe it has a great role, and we are so different. And some of us have skills that others don't have. So for someone who's slammed and far behind in everything, it may offer a great solution. But I found that for the notes from my colleagues, I don't read paragraphs. I cannot. I don't have time for that. I would prefer bullet points or very short paragraphs.
Mhm.
AI right now for that will give you longer paragraphs. And the other thing is sometimes the discussion has been a lot of social issues as well. Now, some systems are bright to extract out the social things and bring only the medical. It may be useful in the HPI, that's for sure. But in my assessment plan, which is the most important thing, I have a system which I think is logical that I start, okay, what are the presenting symptoms and signs? What is the workup, including labs and imaging studies? And then what is my analysis of that? And eventually I go to the treatment. And in the treatment, also, you manage hypothyroidism, right?
Hmm.
All the
Hmm.
time.
Hmm.
So how I like to do it is, okay, in October 2023, I started with 100 micrograms. It led to TSH of 4.5.
Hmm.
So in January of the following year, I went to 125 micrograms. It went to TSH 1.0. So we continued that. And then out of the blue, the patient gained 30 pounds. So now the TSH is 7. So now in October of 2024, I adjusted to 175 micrograms. That led to what? So in just briefing that note, I can tell what I did initially and how things are going. Yeah, I will not do that. You see my point? So how can I make it brief? How can I make it very
Hmm.
efficient? I will not go to the older notes and I have everything done. Can we have collaboration? Oh, absolutely. Can I pick and choose what to put in and what not? Absolutely. Now, in my subsequent visits, I end up having all of the prior history that is relevant under initial history.
Hmm.
So initial history is always copy and paste. And then I have interval history that gets to be 1 to 2 lines. What happened since last visit? And my assessment plan is copy and paste, and I just tweak. So I truly don't spend a lot of time. Things get to be very fast.
What advice do you have for physicians who aren't accurate and fast touch typers? Because it sounds like your system is predicated on the fact that one is an accurate and fast typer. A lot of physicians aren't that. What kind of recommendations do you have for them?
Yeah, there are two ways that we usually go. The first is the easier way, which is work smart, not hard. And then there's the more difficult way, which is work hard. I love having work hard in a smart way.
Hmm.
So I love developing skills, new skills that I didn't have before, if they're going to take me in the right path. Learning touch typing, it takes time. I mean, it took me like 20 minutes every day for a month. Not like invest in hours and hours, but it is a skill that can go a far way. If you cannot do touch typing, AI can be great in the initial history, but in all of the subsequent visits, we truly don't need that. The interval history is just 1 to 2 lines. The
Hmm.
tweaks in the assessment plan, it doesn't take time. But then developing a system where we can get more efficient while being more effective and facing the patient, not giving the patient our bed because the one designed the room, put the computer against the wall, can just go a far way.
You also mentioned that when you do the assessment and plan, you're doing it in real time and talking it out with the patient as you're typing in that assessment and plan. So I
Right.
love that transparency. So tell us some of the advantages of doing it that way.
Yeah. The first advantage is having no surprises with the patients.
Hmm.
Now, after the Cures Act came out, all of the patients had access to their notes. And what I'm going to hate the most is the patient coming back to me saying, okay, you didn't mention that,
Hmm.
or this was inaccurate, or it was surprising to me. So when I write it out loud with the patient, I tell them, you know what, I have no secrets. That's what I'm writing. That's what you're going to read. And also, it establishes that relationship of engagement and involvement. This is my assessment of your situation. And if you have something to argue against, let me know right now and we can discuss it. And that's what we're going to do as well. This is the follow up. I just feel that it brings them to be active in their health.
Now, this excerpt and these tips are from your larger book, No Work After Hours: Tools to Maintain a Pleasant, Efficient, and Productive Clinic Without Work Before After Hours. So tell us some other key tips that you've written in the book.
Yeah, patient satisfaction was a big issue. You know, when we learn medicine growing up, you only focus on the medicine part,
Hmm.
right? And how to be an effective clinician, which is extremely important. But then after you leave and working in a healthcare system like you are, usually they're going to talk to you in three situations, and you correct me here. Number one, you got poor patient satisfaction scores.
Hmm.
Because if you are doing well, they will not talk to you about that. Number two, they're going to talk to you about your revenue,
Hmm.
saying, Dr. Fong, you're a great clinician, but you are not making enough. So you either see more patients or we're going to cut back from your payment.
Yeah.
And number three, your quality metrics. You didn't meet your quality metrics. And then your quality money, if this is part of your productivity, you're going to get less. Usually,
Hmm.
this
Hmm.
is when they talk to you. Very rarely, they're going to tell you, you know what, you didn't prescribe the right diuretic or you give a medicine that causes side effects. Usually not, because we learn our medicine well. So for the patient satisfaction, the question is, okay, how can you achieve good patient satisfaction? The easier way for many clinicians is to spend longer visits and chat about the dog and about the boat and about the new car and whatever projects patients have in their lives. But what I felt deep in my heart, this is not the place for that. The clinical visit is not place for social. Now it's good to know the patients. I'm not saying no, but this is not the place for long social discussions. And this is when I dig deep. Okay, how can I achieve great patient satisfaction while being efficient and while being productive? Maybe I didn't share that with you, but my second book that came after that was Physician Revenue Secrets.
Hmm.
So, how can you be productive as well while achieving all of that? And this is where I found it very interesting that there are basic human skills that we need, like maintaining eye contact. It's
Hmm.
huge. If I'm talking to my son and he's not looking to me in the eyes, I'm gonna feel he's not respecting that discussion. The second is the smile. Now we get overwhelmed by many things, but if you walk in and you just have a smile in your face that you maintain through the visit, Number one, you're going to feel happier. Number two, the patient's going to feel welcome. Number three, having that good listening skills. Now, in general, we tend to jump to conclusions. I guess that's what we get to learn, right? How fast in a multiple
Hmm.
choice question can you read and can you can come to the conclusion that conclusion is right.
Hmm.
So basic human skills can go a far way.
It sounds like common sense, right? But sometimes when physicians are under so much pressure, and like you said, they're under pressure not
Right,
only from the medicine itself, but from the administrators with those three pillars, right? Pressure with patient satisfaction, revenue, and quality metrics. They often forget these basic skills
right,
in the exam room.
right. And we need to remind ourselves all the time, that concept of regression to the mean, that we tend to regress after a while. I remember on my screen, my phone, I had things written down to remind me every day. And every time I look at the phone, don't forget to smile. Don't forget to maintain eye contact till they became habits that I do with every single encounter.
And sometimes I find that patient satisfaction means different things to different patients. For one, some patients may like their doctors talking about social issues that may or may not be relevant to the encounter itself. And then for other patients, satisfaction may be just a clinician being on time and being brief and not spending excess time in that doctor's office visit. Because let's face it, patients have better things to do often than being in a doctor's office.
Right.
So during my experience, I find that sometimes patient satisfaction, you have to gauge what values are important to that individual patient and kind of tailor your approach to each individual patient.
Absolutely. I guess I have a psychologist in my heart as well. And it's interesting when you read about different personality traits and what works with what. Part of what we do, we are leaders, right? We are leaders in our clinic. And in the patient encounter, okay, am I the leader or the patient is the leader? I love the idea of having kind of a co-pilot.
Hmm.
So, but it gets back to be me, the physician, being the leader of the encounter. Some patients don't mind spending 2 hours chatting, right?
Hmm.
I get to be kind of reaching, okay, where is that middle ground? I would love to hear the chats to a limit.
Hmm.
And then we're going to circle back. And in my mind is, okay, the patient is here for, let's say, diabetes. How is the A1C doing? Where are we going to get there? Graves' disease, thyroid nodule, thyroid cancer, pituitary disease. So I have that clinical part. And then we have the social part. And when it is reasonable to just shift gears and go back to the clinical part without hurting the patient
Hmm.
and without also me spending hours, which I cannot spend.
Now, what about those physicians who are just completely overwhelmed? They are chronically behind. They have to spend hours after clinic catching up on their
Yeah.
notes, and they're burnt out and they're thinking of leaving medicine entirely. What will be your single best tip to help these many, many physicians that I hear about?
I'm gonna have a question first. Did you choose that specialty out of love and passion? Because many of the physicians did not.
Mm.
Many did not. I guess my third book that is in the back of my mind is, okay, how do you choose wisely?
Hmm.
And then I guess it's gonna hurt, but I would see it. Some physicians go after money, others go after lifestyle. And then when the decision is not based on passion, they're gonna get what they want, hopefully, but not to the best extent, and then they're gonna get burnt out. Now, let's say that you are where you have your passion. Be humble to, to open your mind and learn new skills and put the time and effort to learning them. Because these are skills that we get to learn how to be efficient with the HR. We get very resistant with inertia. I'm a part of a big practice. I talk to many physicians. I guess our pride and ego get in the way of us learning. But when I humble myself and say, you know what, I don't know everything, and there is an opportunity to learn and grow, it can take a far way. And those who did the best are the best disciples
Hmm.
who got to learn and grow.
We're talking to Michael Morkos. He's an endocrinologist and he's the author of the book, No Work After Hours tools to maintain a pleasant, efficient, and productive clinic without work before or after hours. There's an excerpt from that book on Kevin MD. Michael, let's end with some take-home messages that you would like to leave with the Kevin MD audience.
The one message that can make all of the difference is having good boundaries. Having good boundaries first to yourself, saying, no, this is enough, I need to change. Having a good boundary with the patient, saying, you know what, I cannot discuss results in between visits. Let's have another visit. Having good boundaries with the staff, with the leadership, and good boundaries saying, you know what, I cannot do it on my own. Let me get extra help and try to refine my skills. This can take you a far way.
Michael, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Oh, thank you so much, Kevin, for having me today. I appreciate it.